between us. It's getting hard to reach out. Haven't seen you in seasons, but all I hear is your voice. I know my limits, you can break me down, but I'll stay till the finish line. And I've been counting minutes for quite some time now, just to see you again. And I've been counting days to get away, to see you
At 1 second.
see you again.
I'm just setting things up. We got millions of reasons to let it all go. Hope we're not too broken. I know I'm not always strong. And I've been counting days to get away, to see you again, see you again. Been fighting ways to get away, to see you again, see you again. Hey Spark Girls, welcome to the stream. I'm gonna start the stream in a few seconds, just posting on Twitter. I think I got all of them right yet. Okay, there we go. reduce the volume real quick. And okay, let's go. Hi, Sparkles! Welcome to the stream. Hi, hi, hi. How are you guys doing? Hi. So to introduce myself, hello Twitch, hello YouTube. I'm Dr. Nuke, the Dr. Bunny VTuber can explode anything on touch. And today we're gonna do our usual Med Sundays. So we decided to do Med Sunday every alternate Sundays to improve the quality of the thing. So hi, welcome, welcome, welcome everyone. Hi Zaki, hi Yasin. How are you guys doing? So how's your weekend, guys? How did your weekend go? We can start it slowly. How was your weekend, guys? So while you guys answer that, what I've done with today's Med Sunday is that I've made 10 cases, like 10 case scenarios, with symptoms and signs which I've seen, which is common among our age group, like 20 to 30 years age group. And so we're gonna feed these symptoms and signs and what's it called, WebMD, which is known to have terrible diagnosis for common symptoms. So let's see how accurate can it get, and let's see how accurate can we get. So we're just gonna critic every WebMD diagnosis there. You guys are doing good. Your girlfriend isn't here, so shit. Oh well. I don't know if I should be salty or say oh. That all could be sarcastic. I don't know, maybe. But it's okay, it's okay. Why girlfriend when Dr. Nuke is here? The cure to your heart, the cure to all your problems. Okay. So without further ado, let's get into it. One second, sorry for the black screen. Okay! There it is. There it is. WebMD versus Dr. Nuke. Slides prepared on Canva. Well, she will be here tomorrow again. Oh, sure, thank you. Wait, tomorrow we're not streaming though. Tomorrow is a break. We'll be streaming again on Tuesday according to the usual schedule. Yeah, that's the schedule I'm sticking to. It seems more convenient because, you know, I have the like Monday's a break, Tuesday, then Wednesday's a break, then Thursday, then Friday's a break, then we stream on both the weekends where we're generally more free, and then Monday is like a break to regenerate myself from the weekend exhaustion of streaming. So I feel like, yeah, we will be sticking to the schedule for quite a while till, I don't know, whatever that comes changes it. And today's humid again. One second, chat. Let me turn on the aircon. Not because it's hot, it's cold, but humid. 1 second. Okay, I'm back. I'm back in front. Okay, let's start. It's quite simple slides. I know you guys give me 2 weeks time to prepare, but the entire 2 weeks I was thinking what to add on it before actually trying to add something, and I did come up with some scenarios that I've seen in my past in college and stuff. Gotta lock in, so yeah. I prepared these slides in an hour. It took me an hour to prepare these slides, like maximum an hour, even though it took 2 weeks. So it was like 2 weeks of thinking what to do and one hour of actually doing it. Drop to plat 3 again. Oh my god, I'm so sorry. Drop all the way to iron, and then we go together. I'm joking, I'm not iron, but I do love to go back to iron. It's better than gold. It's better than gold. Okay, let's do it. So case 1. So we're talking about a 24-year-old man or woman. Let's say a woman. Well, okay, so let's go with a 24-year-old woman, a female, with symptoms of persistent eyelid twitching. Okay, his eyelids were twitching, muscle cramps in the calves, fatigue, and occasional hand tremors. So, she's having eye twitching, she's having muscle cramps in calves, fatigue, and occasional hand tremors. So this is a very... I've seen this before. Of course, I came up with this scenario, but this is a very vague thing. It could be a lot of causes, but if you think of the most commonest cause at that age group is mainly because of dehydration. Mainly because of dehydration, because people don't drink water properly. Could be anemic. The patient could be anemic. So if I want to get rid of worst case scenarios, she could be hyperthyroid. That means that she has more thyroid hormones causing these symptoms. Or maybe hypocalcemia, because calcium is required for your muscles and stuff. But mostly I'm saying dehydration. It has to be dehydration. Let's just type in WebMD and see what does he say. So we are going with 24-year-old female. Also menstrual cramps. Menstrual cramps can cause anemia, can cause dehydration. So yeah. But I really want to see what does WebMD say about this. Because I did try to type a lot of shit the last week, and oh my god, I wouldn't believe my eyes. Eyelid twitch. There we go. Eyelid twitching. Fatigue. Calves. Cramp. Leg cramp. What else did we say about this? Occasional hand tremors. So, hand tremors. Okay. Did they have anything called occasional hand tremors here? And that's just... no. Okay, just said hand tremor. And asterixis. That's nothing but tremor. They just... WebMD just likes to be fancy a bit. So let's see what does WebMD actually say. WebMD wants to know your location. Hell no! Why would I ever give my location to my worst nemesis? Okay. Let's see. Chronic fatigue syndrome. Yeah, maybe. I mean, that's so generalized. That's so generalized. Generalized anxiety disorder. Okay, we did say ready for female. Leg cramp? Leg cramp? Now, it looks okay. Eyelid twitching sometimes. Hand tremors, yes. But if I go for generalized anxiety tremors, here's the thing. I'm gonna be mentioning tachycardia, increased heart rate, palpitations, sweating. All these covered in general. She feel panicky. That's what main symptom. The main symptom is feeling panicky. So it's not generalized anxiety. Sorry, that's of course no. Magnesium deficiency syndrome, not for a 24-year-old. Could be, but it's a very rare disease and almost never it won't happen. Plus, if magnesium deficiency syndrome, you'll see a lot of the symptoms, which is this is like so generalized thing of if you want to talk about magnesium deficiency, and you can't say magnesium deficiency syndrome without actually measuring the magnesium levels. So I'd say no. Restless leg syndrome. Eyelid twitching, restless leg syndrome. Oh hell no! I never talked about restless legs. So yeah, first thing, 0, 1, 2. So let's put a tab of score. So every time WebMD answers something right, I give it a point, and every time I find WebMD misdiagnosing or diagnosing something very rare when this is a common condition, then I get a point. Sounds fair. Let me just put a text somewhere. Text. Okay. Like too big. Let's put something right here. Okay. So we're gonna go points. WebMD. Dr. Nuke. Okay, 0 for WebMD. That's so fucking This is a classic scenario of dehydration, and it's a very normal thing. But yeah, WebMD went and complicated it for no reason. See, that's the thing. WebMD doesn't have any. It just lets you type the symptoms. It does not let you type for the duration. It does not let you type the size. Nothing. Just the symptoms, without any duration. You can't expect to get any good results, and people don't know this, or they choose not to know this because they don't want to go to the doctor, or doctor's too expensive, or it's America, and yeah, they just decide to trust WebMD or ChatGPT on this. ChatGPT in a way, okay, fine, but even ChatGPT sometimes we do that some other time. We will test ChatGPT's knowledge some other time, but for today it's torturing WebMD. So I get a point because this is a case of dehydration. Classic case of dehydration. Simple. And imagine you don't think about dehydration, you don't think about that one fucking gamer guy sitting on the chair and playing games all day and not drinking water at all, or forgetting to drink water because it's too overly focused in playing games. Yeah, that's exactly where you are. And plus we're talking about 24-year-old women, and women don't eat properly. Plus I told you menstruation. So all this amounts to a lot of dehydration and maybe anemia, but mainly I'd say dehydration. Women, we can also say a hyperthyroidism, but in a 24-year-old woman, it's there. You can get hyperthyroidism, but it's more rare compared to a middle-aged woman. So let's go back to info. Let's see. 1 second. Yeah. So we're gonna case 2. Case 2, a 22-year-old. I forgot to mention the sex because I did mention in some of the slides, but slides where it's not really needed, I didn't. So let's see. 22-year-old. Let's see. This is a male patient. Let's call him. Let's think of him as a guy because we already took a female patient. A 22-year-old male presents to the ER with sharp. Yeah. Okay, sharp. So sharp stabbing, chest pain in the right side, and pain worsens on taking deep breaths or coughing. Okay, I know what you guys are gonna say. I know what WebMD is gonna say, and I'm gonna say no. I'm gonna just say no. 22-year-old, come on. Do you think he's gonna get a heart attack for a 22-year-old? And it's on the right side. Okay, maybe sometimes you can have pain on the right side. There could be a misdiagnosis or something. But a 22-year-old, nothing else, just chest pain. He only has chest pain. And if he takes deep breaths or coughing, he has pain. This is something a lot of you have experienced in your life, I think. A lot of people have experienced chest pain, but okay, so I'd say costochondritis. Why? Because it's a 22-year-old. You won't see heart attack usually unless it's really obese. or with genetic history, I don't know, you don't usually see heart attack in 20-year-old. If you do find a chest pain, don't just straight away jump to heart attack. Okay, you can do an ECG first. I generally do an ECG so that I don't miss a heart attack, but most of them generally they come like midnight to tortures in the ER. All they have is costochondritis. So what is costochondritis? Just inflammation of your muscles and ribs. So it's the cartilage is the it's in the name, costochondritis. Chondra is nothing but cartilage. So we're basically talking about the ribs here. There's inflammation. So itis is nothing but inflammation. So how do you treat costochondritis? You just take analgesics, like generally aspirin or paracetamol, for certain duration till it cures. Hi Caitlin, welcome to the stream. How are you? So let's see what WebMD gotta say with this. I'm gonna win this for sure. Let's see. So we are talking about a male. What's the age? 22. So a 22-year-old male. He has chest pain. Substernal central knife like shot, stabbing, chest pain, right chest. Okay, see, look at this. Pain in the right shoulder, pain. They don't have. Look at this again. Look at this. Where's the symptom? Where do I say there's a pain in the right side of the chest? They don't have it. This is what I'm saying. They don't have a lot of stuff. And they end up so that's it. I can't add anything else to this because it's not there. Let's see. I put stabbing chest pain, sharp. Okay, we don't have anything else to type. Sharp chest pain. Let's try again. Chest pain on right. Okay, see, there's no right chest pain. I can't type right chest pain because WebMD doesn't give me the option to do that. What else? Pain worsening on taking breath. Pain painful chest made worse by breathing. Pain in chest made worse by breathing. There we go. So let's see what does WebMD come up with. I'd be surprised if they come up with costochondritis, but I look at this, I immediately come up with costochondritis. What the fuck? Okay, I have no words for this. Pulmonary embolism, collapsed lung, pneumothorax in a 22-year-old male, and I have not mentioned anything about genetic history. I have not mentioned about any sort of trauma. You can't say pneumothorax in a patient who doesn't have any sort of trauma. So I think I win this. Okay, there's the third option, which is costochondritis. Heartburn. Okay, so let's go one by one. Why did I say no to pulmonary embolism? A, it's a 22-year-old male. You don't see pulmonary embolism in 22-year-old male. And I did not mention anything about him being bedridden, him having any sort of clotting disorders, or having a heart valve. I haven't said anything about any sort of disease, already existing disease. So pulmonary embolism is sort of a diagnosis that you can't just make by knowing part of the symptoms, part of the history. So this is a strong now. Collapsed lung, pneumothorax. What did I say? What is pneumothorax? Pneumo is nothing but air, and thorax is chest. So air in the chest is pneumothorax. And how does air enter your chest? Okay, guys are gonna say breathing. But breathing enters your lungs. Lungs are in the chest. So air. So lungs are in the chest, but the how do I explain? Lung is like a cavity. the air does not escape through the lungs. But then how does the air enter? So there has to be some sort of a puncture, either external or internal. So what happens is if there's a trauma to the chest, so that means immediately either there's air entering from outside to inside, or if the lungs or the pleura is hit, then the air goes from inside the lungs to the inside the chest. So that's gonna make a air-filled cavity inside your chest. So that's what's pneumothorax. And I did not mention anything about a trauma, so you can't really say pneumothorax. Costochondritis, that's what I said. It strongly suggests costochondritis unless ECG says otherwise. So we always do an ECG, but most of the time it's a costochondritis. It's something which you all have. It's just inflammation of your ribs or the muscles around it. You're gonna have this sort of a dull, sometimes it's dull aching, sometimes it's sharp. Acute pain is usually sharp, but usually you have a dull aching pain around your chest. A lot of times people suddenly come to the ER complaining, oh, my chest hurts, but it just turns out to be costochondritis. Heartburn or GERD, I think. Okay, this is one of the rare type scenarios where there's literally no other symptom except for chest pain. It just turns to be heartburn. It just turns to be esophageal reflux. So now, I mean, it's rare. It's rare just to show up with chest pain. Usually you'll have acidity, you'll have, you know, the symptoms of a reflux. What you normally have, you'll have that sour taste behind your throat. You'll have burpee, you'll feel burpee, indigestion, all that will be in GERD, but I did not say anything about that, so highly unlikely. Generalized anxiety disorder, depression, yeah, you'll have a chest pain, but I think you'll know it yourself. You'll have some sort of breakdown, you'll feel depressed, you'll feel sad, you'll feel panicky, and then your chest starts to hurt. So I think there'll be a lot of the symptoms preceding that, which you should be telling. So highly unlikely, highly unlikely. I'm not gonna go into further because I don't want to see the horrors. So I think still get the point because costochondritis is the first diagnosis, and putting pulmonary embolism in the beginning is sort of no. So I win 2-0. I'm taking that win. A second. 2-0. Mine. Okay. Okay, we're already having a good heavy move. So let's go to case 3. Okay, case 3. This is something which I personally have. So, a 25-year-old with 8 months history of loose stools 3 times a day. Not something which I exactly have, but something which I know of, and something similar I had. But anyways. So loose stool 3 times a day, abdominal pain relieved by defecating, and fatigue. 8 months. I know what. Okay, I kind of know what WebMD is gonna say, but it might say correctly. But I feel like there's a lot of misdiagnosis as well here. It's quite simple, and I know what you guys are gonna say, but it is not. I already know what you guys are gonna say. So 8 months, it's chronic. It's really, for 8 months you've been defecating for 3 times a day. So you have occasional abdominal pain. I forgot to add the word occasional, relieved by defecating and fatigue. So okay, no, few people think, oh, this is cancer or TB or HIV. No, it's not. None of the above. Okay, all of them have. But I did not mention anything about weight loss. I did not mention anything about weight loss. I did not mention anything about an abdominal lump, any sort of swelling. So you can't really say cancer when I did not say any of this. There has to be other symptoms if you have to be cancer. Can it be Crohn's or ulcerative colitis? Inflammatory bowel disease. So, no. Crohn's and ulcerative colitis, first thing, okay, Crohn's can affect younger age. Ulcerative colitis, you won't see at 25 years age group. Next, either of them you'll have weight loss. You will have weight loss. And there's no such history of weight loss given. So maybe he's a healthy guy and we didn't have to mention the weight loss history there. Plus it's just a 25-year-old. So Crohn's you won't have occasional abdominal pain. You'll have very frequent abdominal pain. And a lot of food doesn't set right with you when you have Crohn's. So this is a classic case of irritable bowel syndrome. Usually you diagnose it after 6 months exposure of these symptoms. Let's see what does. So irritable bowel syndrome is nothing much in treatment wise, it's just symptomatic treatment. Now there's new drugs coming up for it, but mainly it's symptomatic treatment. And a lot of people have it. It's strongly associated with obesity, insomnia, poor eating habits. So stay healthy, you will be healthy when it comes to IBS. Let's see what does chat. Wait, let's put it as a 25-year-old male. 25 male, continue. So where is his main? Okay, loose stools. Loose. Okay, one more thing, hemorrhoids. You could have hemorrhoids, but hemorrhoids you classically mention blood in stools. This is what I think of hemorrhoids, but there's no blood in stools. Occasional loose and watery stools. Loose and watery stools for 4 weeks or longer. There we go. Wait, remove all this crap. Now, what else? Abdominal pain. Okay, I can't. This again, as I told you, there's no option for saying how it's relieved, because that's also one of the very important parts of history. Abdominal pain. Chronic. Let's just put postprandial abdominal pain. And what did we mention? Fatigue. Okay, continue. Let's see what does WebMD come up with. Okay, I think I did not expect that, but let's go. WebMD finally gets a point. WebMD finally gets a point. So irrespective if I'm correct, if WebMD gets it correct, WebMD gets a point. So irritable bowel syndrome, as I told, it's a classic case of irritable bowel syndrome. Lactose intolerance. I did not mention anything about milk products. I did not mention bloating abdomen. Classic case of lactose intolerance. You'll have bloating. Your stomach will be bloating, and you'll have a lot of flatulence, stinky flatulence. Then viral gastroenteritis. No way. I said 8 months. Viral gastroenteritis usually lasts for maximum a week or 2. That's it. Not more than a week usually, and 2 is like rare. So it's not viral gastroenteritis. Diverticulitis. 25-year-old male. Diverticulitis is like, no way. Plus, diverticulitis, you'll have more constipation, you'll have fever, there's a lot more symptoms than just this. So, and such a long duration, it's not diverticulitis. There's no way it can be diverticulitis. Crohn's disease, again, I already told you guys there will be weight loss, there will be significant abdominal pain. The patient will complain a lot more symptoms than what I mentioned. So I'm giving this 1 point mainly because the first thing is irritable bowel syndrome. So congrats to WebMD, you have not outsmarted me, but know what I was thinking. Give me a second, chat. Give me a second, chat. Hit your dashboard. Okay. What's wrong with... Wait, oh, it's not alive? Okay. Okay. The next. So, yeah, we already did case 3. So, case 4. Case for a 24-year-old male. Okay, we are mentioning male for the first time. I mean, gender for the first time in the case. Maybe it's of some importance. Let's see. Acute history of lightheadedness, dizziness, fatigue, and palpitations for 1 day. Huh. Okay. Acute history of lightheadedness, dizziness, fatigue, and palpitations for 1 day. This sounds very generalized, so I probably would need more history out of this. Maybe it's just something psychiatric, maybe there's actual neurological cause, maybe he didn't eat, maybe he just didn't eat, that's it. He probably just didn't have enough food and he's hungry, and now we start to feel lightheaded, dizzy, and fatigue and palpitation. That's very common. Maybe he's anemic. There could be anemia. This is something which I had frequently before. It's called SNRI withdrawal syndrome. So if you don't take your acetalopram for more than 3 days, you start having acetalopram withdrawal. So basically it's the same things that's here. I did write based on what I had, but I feel like there's a lot more good causes for it. So let's see. What's the most probable cause? Most probable cause is just that acute just hunger. It's just hypoglycemia. I say my first primary option would be hypoglycemia. Hypoglycemia, then I think of anemia. It's 24-year-old male. I didn't say female. If I'd said female, I'd probably first think of anemia. So again, I'd like to put dehydration here. So dehydration can also cause this. Dehydration, hypoglycemia. So my first two options are hypoglycemia and dehydration. If any of these two come correct, then I will give points to WebMD. Otherwise, probably it's gonna think of something rare. Let's see. 24 male. Continue. What did I say? Lightheadedness. Dizziness. Palpitations. Fatigue. That's it, right? Okay, that's it. These are the 4 symptoms the patient can give. It sounds very generalized. Anemia, iron deficiency. I told you guys. It's a 24-year-old male, so anemia is... It's on the list. It's on the top 5 list, but I wouldn't put that as first. Because when it comes to this age group, you see a lot of cases of dehydration and hypoglycemia, and that's often mistaken for something bigger. Okay, first, when such kind of patient comes to ER, instead of thinking of anemia, I check his blood sugar, his vitals, and then I look for blood levels. So I wouldn't put anemia in the first diagnosis at all. Hyperthyroidism, yes, it can happen. Hyperthyroidism can happen, but no. Wait, I think it's not very common in a 24-year-old male patient. It's rare. It's rare. I wouldn't say it's not possible, but it's very rare. So I wouldn't put a strong match on this. Panic attack. Lightheaded dizziness in a panic attack is not a very classical symptom. You will have a lot of other symptoms as well in the case of panic attack, and that is not mentioned here. Okay, so now, panic attack, unlikely. Could be, but I'd say unlikely. Here's the thing. In the field of medicine, there's nothing impossible. There's nothing impossible. It could be very highly unlikely, likely, but not impossible. Because anything, I mean, we're still studying the human body, as you know, there's so many things that we don't know, so you can never actually rule out anything in medicine. There's always an answer for everything. Could be an answer for everything. And if there's no answer, there will be research on it and people will bring out an answer. It's very rare to say that this is not possible in medicine. So that's why I'm not saying WebMD is wrong. I'm just saying it's unlikely. It's rare. But it's not wrong. It's not possible. It could happen that maybe the patient has only these symptoms, comes with panic attack. Say we diagnose with panic. It could be, but it's unlikely. I wouldn't say it's anywhere close to likely. Hyperthyroidism, rare, but not impossible. Because 24-year-old male with hyperthyroidism is really rare. So when you want to think of something first, I'd say hypoglycemia and dehydration, and then I'd come to anemia. So I'm kind of taking away WebMD's points here because they never mentioned anything about what I've mentioned first. So that's 3 for me. Okay, let's go to case 5. A 23-year-old female with pounding headache on the left side. Ooh, interesting. A pounding headache on the left side, heightened sensitivity to light and sound, and also complaints of a stiff neck for the past 1 day. Back to Platic, congrats, Zyke, welcome back to the stream. So, okay, so pounding headache on the left side, heightened sensitivity to light and sound. This sounds a lot like migraines, so I'm gonna say it, migraine. Unless there's history of trauma, unless there's history of hypertension, I'd say migraine. Because if there's any other comorbidities that may change, not completely change, but may change the diagnosis. But when a patient comes only with this, I'd say migraine. Okay, now stiff neck could be meningitis, but unlikely because you won't have one-sided headache in meningitis. And heightened sensory light and sound, that's like that's aura. That's like the migraine with aura. Now let's see what does. So it's a 20 and female, and I mentioned female. It's very common. Migraine is more common in females than males. So headache. Did I mention the side? Left-sided headache. Left headache. Unilateral. Is there a weight? Okay. Oh my god. I can't really. Okay, the headache based on the side, there's different types of headaches, and it's not letting me actually choose a particular side. So this is another thing I was saying. There could be a lot of causes of headache if you keep just like this. Headache. Oh. Headache in the morning, headache, one-sided headache. Okay, never mind. They had this option suddenly pop up. Okay, I'm kind of happy. They did that. Heightened light. Photophobia is light hurts eyes. I'm not gonna say photophobia because I'm talking in patient's terms. A patient doesn't come and say I'm having photophobia. They say lights hurting my eyes. Sound. My god. Okay, I can't really. How do I? So there's nothing for sound. There's literally nothing. I can't say anything about sound there. Neck stiffness. So I'm just gonna say migraine first. If it doesn't say migraine first, I'm not giving it any point. Stiff neck. Continue. Okay, migraine first. I told you. Yeah, WebMD gets the point here. Cervical spondylosis. 23-year-old, no way. No way. Strong match and no. Tension headache. One-sided headache again. Because I'm photophobia or highly unlikely to be tension headache or cluster headache in that aspect. It's migraine. So WebMD, congratulations. WebMD gets a point. So the 2 and I'm at 3. So we're done with 5. There's 5 more to go, and let's see who wins. Okay, next question. Case 6. Ew, okay. This is something embarrassing for a few people, and I don't want to talk too much into it, but it's something you should be knowing. So a 19-year-old male. So that's a really young male. Okay, 19-year-old came to a doctor. Fair, complaining of tiny bumps on his scrotum. That must be super embarrassing for him, and itching around the area. So let's see. First thing I'd say, ask for sexual history. 19-year-old male having a high multiple sexual partners, unlikely. Unless you're a gigolo in college. I don't think this is very common in this modern era. Because now 19-year-old people are very smart, plus they're iPad kids, they don't go out much. Forget about having sex with multiple people. So let's see, he has tiny bumps on his scrotum. That could mean STD, but I actually thought of this as no sexual intercourse till now, like no sexual history. So this is a case of folliculitis. So yeah, first you have to ask sexual history. He may be embarrassed to talk about it, so you should ask in confidentiality and make sure nobody's listening apart from you and him. So in this case, I wanted to mention no sexual history, but that's why I put it a 19-year-old, because it's rare. It's rare to contract STDs being a 19-year-old. I'm not talking about people who are highly sexually active, which is not that common in this modern age. And itching around the area. So first thing I'll think of is folliculitis. Second, I think of herpes, and syphilis won't be multiple bumps. So mainly just STDs, herpes, but my first would be folliculitis. Let's see. I'm saying if it's not folliculitis at first, I'm not giving an option. Could be why? Because you see, WebMD does not have an option for talking about sexual history. Okay, now if it suddenly gives me a pop-up say asking for sexual history, I'm gonna put no or minimal. Let's put it in minimal. Well, I can't really scrotum. Scrotum hurt, scrotum swollen, scrotum lump, mushy lump. Swollen. I can't really find a good scrotal cyst. Let's go with swollen scrotum. Itchy. Okay, your patient's not gonna come and say, I can't really find itchy scrotum. Thank you for banning, Zaki. Okay. So I can't find itchy scrotum. I don't know what you type. Inflamed scrotum. No patient's gonna come and tell you inflamed scrotum. Itchy genital. Itchy private parts. Okay. Itchy private part. Says he's swollen scrotum and itchy private part. I couldn't come up with bumpy scrotum or lumps. There was lump, but that lump definitely meant something else. I'm sure of it. Let's see. Fun fact, they didn't ask about sexual history, so I'm pretty sure WebMD is not going to come to the right diagnosis here. Balanitis? I said scrotum. I didn't say penis. Contact dermatitis test. Oh my god. This is a nightmare. As a doctor to see this, it's a nightmare. Because balanitis, I did not talk about penis. No, it's not balanitis. There's no way it's balanitis. Contact dermatitis. Contact dermatitis on the inguinal region is super unlikely. What kind of occupation you're in to get contact dermatitis there? And don't say prostitution. No, you can't get contact dermatitis that easily in that kind of areas. You usually get contact dermatitis on stuff like your chest, your forehead, just generalized skin, your arms and all that. But getting in your private, because it's highly protected, it's protected from your pad and your underwear. So no, contact dermatitis there, you're gonna get first somewhere else and then there. So there has to be some other history suggesting contact dermatitis, otherwise it's saying no. Testicular torsion, oh my fucking god. The nightmare of a pain you're gonna have if you have a torsion testis, it's like, imagine someone grabs your balls and twists them, like literally twirls and twists them, and doesn't let you untwist them, and they just keep twisting and twisting. That's literally how bad it is. You sub to my YouTube channel? Thank you, Zaki. So no, this torsion testis, you have severe pain. I did not mention about pain anywhere, and they haven't come up with what I said, folliculitis or any of sort of a dermatological condition apart from contact dermatitis, which is still incorrect. And the first one was balanitis, so I wouldn't give it points anyways. So I'm sorry. I'm sorry. Yeah, you're not getting points here. So I'm at 4 and the WebMD at 2. Okay, before we get into the next question, I wanna tell you guys something. I did ping everyone in my server and posted all over my social media, but yippee! We officially have surpassed 500 subscribers on YouTube and 400 on Instagram, and we're 13 away from 300 on Twitch, which I'm super excited. I hope we get to it. But thank you guys so much for showing your support all over my social media, and I did not expect my Instagram to blow up so much. And not just that, for the first time people from other social media are cross interacting with me, either in Discord or in my Twitch feed. So I'm really happy with my Sparkles community on Instagram. So thank you guys so much. Thank you so much for the support, and I hope you guys keep believing in me. Okay, so let's go to the next case. So case 6, I won. Case 7. Case 7. A 21-year-old male with sudden history of chest pain for the past 1 hour at night. Interesting. So at night, as in, I wanted to say he came at night. He came to the ER at night. I couldn't I kind of framed the question wrong here. So he came to the ER at night saying he had sudden history of chest pain for the past 1 hour with dry cough and increased sweating. Okay. 21-year-old. Interesting. Chest pain, dry cough. I know what you guys want to say again. Heart attack. Heart attack. Heart attack. Unlikely. 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 There's two diagnoses I'm going to come up with here. So first is GERD. GERD, or we call it gastroesophageal reflux disease, which I did talk about in the beginning. So these are some common symptoms of GERD, but when a patient, I diagnose them as GERD, I also check for the ECG to, because I said rare case scenario of a heart attack, the patient might have just this. They might have just this came early as a heart attack patient, but 21-year-old male, kind of rare. 21-year male, you'll have frequent heart attacks, but 21-year-old is rare. Having heart attack at that age is rare. Plus, only the symptoms are rare for heart attack. Maybe early heart attack, maybe they can have, but I'd say GERD. But listen to my crazy diagnosis here. 21-year-old, once a person turns 21, there are this urge to try out new things, and you know what I mean. Most of the countries drinking age is 21, so people are gonna go, you know what, let me just go get drunk heavily. And I said at night. So this is sort of a detective mystery, and I've had the patient like this before who said, and I somehow managed to drive them out, but they came, okay, let me tell you the story. So I was in the ER. It was around 1 a.m. A patient comes in he's around 21 years old, along with some other people. I don't think he's 21. I don't think he was 21 because he was lying about some stuff. So I think he was probably 20 or 19. He came with his friends and he was like, I'm having severe chest pain. I'm having a fucking heart attack. Please treat me. I feel like I'm gonna die. I already knew he was quite drunk. He looked quite drunk because, you know, you can tell the smell, the way he behaves, the way he walks. Checked his vitals. All his vitals were normal. He was having a bit of tachycardia, or nothing but increased heart rate. He was saying he is having palpitations. He's having a lot of sweaty. He's having cough. He's having chest pain. Yeah. It's just alcoholic gastritis. It's just alcoholic gastritis. Commonly presented like this. It's especially people who don't drink much or drinking for the first time. It affects them way worse, I think. Or you don't you don't eat before drinking. So that was typical case of alcoholic gastritis. That's why I added this. So I'd say alcoholic gastritis or GERD. If any of these three are not in my first option, I'm striking that. But because 21-year-old male heart disease is not my first choice, I will do an ECG, but that's not on my mind when I take the case. 21-year-old male. Chest pain. Let's see, he came with stabbing chest pain. Let's put stabbing chest pain. Okay, so why I didn't trust him? Because I asked him if he drank alcohol. I asked his friends, and everyone were lying. So I got very angry at them because I know they're lying. And yeah, we just somehow managed to just give him some medicines for his gastritis, and we just sent him off. Let's see, stabbing chest pain, dry cough, what else did we say? Sweating, sweating more, If we put the info, okay, we did. So let's see conditions, continue. Bacterial pneumonia. Oh my god. No. Just because I said dry cough doesn't mean you're gonna have pneumonia. Plus, the patient should have fever. They did not ask me for it. Look at this. They did not ask me for the duration again. Duration is very important when diagnosing because we have hyperacute, acute, and chronic duration, and each has its own diagnosis. What we differential diagnosis, what we can think of, and not having that in a website like WebMD is a big disadvantage and highly untrustable. So bacterial pneumonia, highly unlikely. Stabbing chest pain. You could have stabbing chest pain. You could have dry cough. Sweating more is unlikely. You will have fever. Okay, with fever you could have sweating. But no, bacterial pneumonia is not on my list at all for this. Bronchitis, same thing. Same bronchitis. 21-year-old. He has to be a chronic smoker for something like COPD. Pulmonary embolism. I'm gonna fucking go shoot them in their face whoever designed this website. I'm joking. Please don't take this in offensive. But yeah, it really pisses off a doctor when he looks at all this. And me looking at this, I'm gonna say no. Just no. Costochondritis. Okay, this is one more I should tell you before. A case with costochondritis acting as a very severe chest pain or sweating. But seeing that extreme case of costochondritis is actually quite rare compared to what I said, alcoholic gastritis here. So no, costochondritis, I'm not gonna put. Asthma, teen and adult. You have breathlessness. You will have breathlessness. I had childhood asthma. You will have severe breathlessness, severe cough. Just because I said dry cough doesn't mean asthma, it doesn't mean bronchitis, doesn't mean pneumonia. Also pneumonia will have wet cough, productive cough. So, no. This is like crap. This is just crap. Okay, I win this clear, fair and square. We're on 2-5. So we have 3 more to go, and so far I'm winning hard. The only way the WebMD can win is getting all 3 correct next. Let's see, case 8. A 20-year-old male with sudden history of palpitations. Why I keep going chest pain is because it's a common thing among 20 to 30-year-old people coming saying they have chest pain, but turns to be something else and their heart is in perfectly fine condition. So a 28-year-old male with sudden history of palpitations, anxiousness, increased sweating and fluttery heart for the past 1 hour. So it's a very short duration. It's not really like a anxiety disorder, panic attack. Clearly it's a panic attack. Let's see, let's think of something else. Let's think of some other diagnosis that we could come up with, but my head keeps going towards panic attack. Okay, maybe he's drunk. Maybe he could alcohol intoxication. Maybe he's under on some drug abuse. Even that can cause all this. So I put all this before heart attack because he's a young male. He could be under drug abuse. He could be under alcohol intoxication. He could be just having a panic attack. Having a heart attack is highly unlikely again. I'm gonna say fluttering heart rate, saying it's AFib or afibrillation. Unlikely in this age. So let's see. I feel like WebMD might get this correct. So he's 28 male. Next. Palpitation. Anxious. Flutter. Irregular heartbeat. Sweating. Let's see what WebMD comes up with. So again, panic attack, strong match. Let's go. Okay, WebMD want this, kind of want this. Panic attack, correct. Atrial fibrillation, highly unlikely. Strong match, but highly unlikely. Rare. Hyperthyroidism, mitral valve collapse. Hyperthyroidism, yeah, you can have, but you don't see some stuff like drug. You have to also think about stuff like drug abuse and alcohol intoxication. More, I think still panic attack is correct because I mentioned anxiousness. Probably why WebMD said okay, he's maybe just talking about panic attack. But a lot of people don't come with saying they're feeling anxious. You have to pull the information out, and that's when you feel like no, it's just a case of panic attack. So I'm giving it this point just because they said panic attack first. I'm still pretty triggered with AFib. I don't want to give a point because it said AFib here, but I'm giving it anyways because I feel bad. I'm 5, WebMD's 2. I just feel bad. And plus he did say panic attack first, so I'm just gonna give it. So there's still a chance for WebMD to tie with me because I'm 5 and it needs 2 more, correct? And we exactly have 2 more questions. So let's go to the next question. A 22-year-old with sharp shooting pain radiating from right hip to right thigh and occasional numbing of right lower limb which worsens before sleeping. A lot of diagnoses went through my head just now. I'd say sciatica, but before sciatica is more of a general term. I'd say a lot of things can cause sciatica, so I'm not gonna give it points if it just says sciatica. So we need to pull out the reason. So we're talking about a 22-year-old person worsening before sleeping. So this is like a very important clue. Why did I say worsening before sleeping? Because this is a scenario I came up while sitting on my chair. So what happens when you sit on the chair for so long? Imagine you're just a 20-year-old working guy, working adult, made to constantly sit on the chair 24/7, and then you suddenly start feeling your legs going numb and it's tingling. So I'd say it's because of that. It's because of compression of the nerve due to chronic sitting. So that's sciatica. Sciatica is when now sciatica can be caused by a lot of things and a different age group, so I'm not gonna say sciatica. I want to talk about nerve compression at reason of nerve compression, because clearly this is a nerve compression. Big shooting pain, all this is just nerve compression. So irrespective, we are talking about nerve compression, but why is it occurring? That's the main important part of the diagnosis here, because you're just gonna say nerve compression is not gonna treat it, nor it's gonna actually diagnose anything. So why is the nerve compression occurring? Because I told you, he's probably sitting for a long time, and that's why. So what are the other ways you can actually get a nerve compression? Disc collapse in a 22-year-old, highly unlikely. It's probably you'll have an elderly or middle-aged people where imagine you're sitting for a long time for chronic periods. It's gonna have heavy basically your lumbar vertebra or your bottommost vertebra are holding your entire spine there, and because of gravity, it's gonna eventually the muscles are gonna get weakened, and there's gonna be compression. There's gonna be a collapse of the disc space, so that's gonna cause nerve compression, and you're gonna have these symptoms. But in a 22-year-old, I'd say it's mainly because of chronic sitting. So let's see. You're gonna go to WebMD and type all this, and if it says sciatica, how are you gonna treat it? What are you gonna do for sciatica? There's shit ton of diagnosis and shit ton of treatment for sciatica based on where is the location of the compression. So I'm not gonna give it points if it just says sciatica. I'm definitely gonna give it points if it does not say sciatica in the first 22-year-old male with leg, maybe, no wait, did I say leg pain? I said shooting. Oh my god. Shooting. What the hell? So I can't have shooting pain. Shooting pain is one of the very characteristic, unique words in medicine which describes nerve pain. And not letting me type shooting type of pain is criminal for a website like WebMD. There's no shooting type of thing. Let me just remove this first. So what are we talking about? Occasional numbing of the leg versus with before sleeping. Numbness. Numbness in foot. Thigh pain. Okay, okay, I can't really find. Yeah, I can't really find that specific term. You just go hip pain, type pain, and numbness in foot, numbness in leg. Numb legs. Okay, let's see what it comes with. Cervical neck herniated disc, lumbar spinal stenosis, multiple sclerosis. Oh my god. Okay, can happen, but putting as a primary diagnosis with just knowing the symptoms and coming with these three is like criminal. It's criminal. So first you're gonna think about general diagnosis, how it could have happened. Think about in the patient's scenario. He's 22, male. He's probably working adult. You're gonna ask him, are you working? Are you doing a desk job? Yes, he says yes. He's having hip pain, he's having numbness of foot, he's having a type pain, he's having shooting type of pain, which I couldn't type in WebMD, so not my fault. Numb legs. You're not gonna go say, oh, you have a cervical leg herniated disc, because that's gonna have much more symptom and it's much more important and rare. So it's rare, highly unlikely, putting it as a moderate match is a joke. Lumbar spinal stenosis at age of 22 is a joke. It's literally a joke. I'm not gonna say it's impossible, it's very rare, but it's basically a joke. Multiple sclerosis can occur. It can occur. It can occur with these symptoms, but it has a lot more symptoms than just these. And again, it's a rare diagnosis. I know someone with MS, but it's a rare diagnosis. So if you're not gonna just go jump into multiple sclerosis when you just see a patient like this, just think simple sciatica. They even come with sciatica. I'm not even gonna think about it. Yeah, I clearly win this game, but let's keep going. Because we have two more? Wait, we have one more. Let's see how hardly we can crush WebMD. So, case 10, let's go. Case 10, a 23-year-old male with sudden history of appearance of a blind spot in the center of his vision. Blind spot in the center. Okay, this could mean a lot of things, but let's keep going over. Over a period of few minutes, expanded into flashy, zigzaggy ring of light with patchy blindness. Patchy blindness. He also has a throbbing headache. Okay. I can actually think of a lot of diagnoses here. But we're talking about a 22-year-old male who's probably still in college. I'm gonna ask him the history. Is he in college? He is. So these are something I can't input in WebMD. These are some history I can't input in WebMD, but play a very crucial role in the diagnosis. That's the thing. WebMD, there's a lot of things I can't input in it, and which play a major role in diagnosis, but they don't let me input it in it. So that's literally where the talent of a doctor and WebMD. You may think, okay, WebMD knows everything. I'm just gonna ask it, but it can't ask you. It can't ask you. That's the important thing. As a doctor, I have the knowledge, I have the skill to pull out the diagnosis from you itself by symptoms and science. I don't need high-level investigations, advanced knowledge to make a diagnosis. I just need you to talk. I just need you guys to talk, and the diagnosis normally come to me by asking a few history and slowly dragging it to what I want to know. That's not the case with WebMD. WebMD is more objectifying. You type in your exact symptom, maybe that symptom is not there, and then you have to leave it, and it's gonna come up with another diagnosis, or it's gonna worst case comes cancer. We already saw something like that. Now again we saw next cervical neck herniation. Then there's lumbar disc herniation. There's lumbar disc stenosis. Oh my god, why go so complicated? Multiple sclerosis, why go so complicated? I did not say any other symptom. Here, I'm gonna strictly stick with the eyes. Throbbing headache, blind spot, 23-year-old male. My first thing is actually a case from my college. It happened to one guy during an exam. So I'm gonna say this as stress induced or lack of sleep. Stress induced sounds more accurate. Stress induced blindness. So this is a common thing actually. A lot of people might have experienced. Imagine you don't sleep for the entire night. You have an exam coming up tomorrow. You haven't studied at all. You have, I don't know, 8 hours left to go. That means the entire night you can still study and fucking crack the exam. So you don't sleep at night. You come to the exam center like completely sleepy or having a headache. You look at the paper and suddenly you'll be like, I'm blind. I can't see anything. What the fuck? One of your eyes just goes, goodbye, I can't do this, I'm going to sleep. So that's literally what happened here with stress-induced blindness. But again, I did not mention anything else history that goes to stress-induced blindness. Other things we can think of is glaucoma. But to diagnose the glaucoma, first thing, you won't have a throbbing headache. You could have a throbbing, but you have a severe eye pain, acute angle closure glaucoma. You'll have a severe eye pain. You'll have a sudden history of pain, same like this. you won't have immediate blindness, you'll have progressive blindness. So this is also progressive, but it won't be exactly like this. Okay, but center of his vision again, scotoma. That is another acute glaucoma. So I'm gonna say my first diagnosis is stress-induced headache, because this is a question from what I saw in my college years and among many other people. My second diagnosis will be glaucoma, because this looks a lot like glaucoma. It looks similar to glaucoma. 23-year-old, again, glaucoma is rare, but I'm not gonna say impossible, because I know of someone who got glaucoma at a very young age. It's still common. It's still fine. It's still, you're coming to ophthalmologist with this, they will think about glaucoma. They will look for your fundus. They will look at your eye. So these are the two diagnoses I can think of. Other stuff like retinal detachment, there has to be some sort of trauma and very rare, so I'm not gonna put in diagnosis. So let's see. What's his age? He's a 23-year-old man. 23-year-old man. Okay, blind spot. Blindness. Ring of light. See, this is the thing. I can't exactly talk about the progression of the disease and WebMD, so the patient ends up typing like this: I'm having a blind spot. I then had a blindness, but I can't type this. So I'm just gonna type like this: ring of light. Okay, let's go with flashes of light. Patchy blindness. Let's go with partial blindness. Something about partial blindness. Yeah, I can't really think what do you mean by partial blindness. It doesn't make sense. Throbbing headache. Okay, headache, and then it should show up the throbbing option. Pounding. Now let's see what dear WebMD gonna say. Migraine. Okay, because I said flashes of light. Give me a second. I kind of disturbed it. I'm gonna remove it. Let's see what we flashes of light. Scarlet Milius is migraine, but I did not exactly mean flashes of light here. Again, it says migraine, retinal multiple sclerosis again. I said these are highly unlikely diagnoses. Migraine, you won't see blind spot and blindness. I'm so sorry. No. Strong match, highly unlikely. No. So, as I already told you guys, this is classic case of stress-induced blindness or glaucoma. So it's either one of these two, and none of them are mentioned. So I already gave a good explanation for all these three, why they can't be the answer for any of them. Migraine, you'll see aura. You may not see aura, but you will not have something like blind spot or blindness. Again, it's not impossible, but it probably would be very rare. Retinal detachment, it should be at this age, usually is traumatic. There's no history of trauma. So retinal detachment is highly unlikely in this patient. I wouldn't put in a moderate match at all. Multiple sclerosis says fair match, but multiple sclerosis, there's a lot of the symptoms that needs to show up apart from having this. Plus you won't have acute headache in multiple sclerosis, so it's not. So I'm gonna just win. I'm just gonna call this my win by a large margin. So 7-3. 7-3. I just butchered WebMD. Okay, let's go. Again, these symptoms are not something just cooked up by me. These symptoms are something which I've actually personally seen in my college and hospital years. among the age of 20 to 30. So these are common symptoms that are supposed to, common diagnosis, common symptoms, common something really common that happens between 20 to 30, and WebMD has gotten them wrong by saying it's something like multiple sclerosis or cancer or disc herniation. Oh my god, that was, what the fuck. So I did give some grace points in between, so that 3 was sort of me being lenient towards WebMD there. So I murdered WebMD, and Dr. Nuke wins once again. So let's go. Let's play League now? I feel like playing League. Let me open League and change the category. We're gonna play some ARAM, and I'm hungry. I'm just gonna type it down so that people don't message Dr. Nuke. There you go. Did I turn on League? Uh-oh. I want to turn as administrator. Give me a second, chat. How do I stream settings? Edit. League of Legends. What the hell? Okay, that's weird. Oh my god, my throat hurts. I'm exhausted. Okay, so this will be uploaded as a board on both YouTube and Twitch, and I will be uploading quick clips from the stream to Instagram and YouTube so that nobody misses anything. So make sure to be subscribed or followed to my Twitch and Instagram, so that even if you do miss out a stream, you can always watch the clips. Let me drink some water, man. I'm tired. My voice is dying. Also chat, once I'm done with my exam, I will try to be more active on my streams, because I think that's the only time I will ever get to actually be full focused on my streams. Wait, what's Sign and Kate playing? Oh, they're playing ranked. No one's playing ARAM these days. It's rare to find someone who plays ARAM. I used to play a lot of ARAM with them, and they just stopped playing ARAM. I don't want to play Ambess. I wanted locks. I don't think they're gonna give me that. Or if I just go Celine. What if I just go Celine? I don't have a skin on Celine though, what the fuck? I should have just gone out better. I wanna have some fun, and I don't feel like having fun playing Ambessa right now. At least at this moment. Okay, we're gonna play a couple of games of ARAM and then call it a day because I'm genuinely exhausted. Okay, ability haste and Q is actually quite big. Try to go as much max mana because this is gonna be a very mana consuming build. Oh, okay. I'm also not used to playing Celia, so it's gonna take me a while to get adapted. Nice. I think I'm dead. Oh, barely alive. What the fuck? Okay, he tried to flash and kill me. Careful. Lol. Are that? No, the shield! And he leveled up at the right time. Oh my god. I know what to go. I forgot its name. Graphics. Rod of eggs. Nice. Keep stacking up that ability haste. Oh my god, I'm playing on 30 FPS again. Bake. Uh-oh. Oh, what killed me? The Talon W, I think. Wait, I'm met only one who's level 5? What the fuck? What the hell? Oh, pressed it right on time. Wait. Oh, Shogun died anyways. Thank you for picking that up. I can't do much here. Nice, GG. Oh, that was clean bolt. That was so clean. Oh wait, hold up. He's dead. He's just dead. He's just dead. I'm done. Oh shit. Nice. Nice. Stun him again. Not bad, actually, we're not going that bad. I thought it was kind of a criminal move to not go Ambessa here, but... Ow. Keep poking me out. And nice. Both help us back. Ooh, really good. Oh, he's dead. He's just dead. There's no way he lives. Oh, no way he lived that. No way. Uh-oh. Bye-bye. How? Again, 50% movement. This is quite useful, but so is ability haze. Let's go Ludens. Ludens. Okay, my ability here, Sam, should be stacking now. Oh. I'm dead. Oh, he's only hitting me. Okay, finally. Nice. Well. Nice. Oh, crap. Barely escaped that. I don't know what to do here. Okay, he picked that up. What the hell? Wait, oh no. Okay, he dies. Nice. that burn is crazy. Can't really. That actually kind of saved the Navi. He should have just tried to kill him. Oh crap. Nice. No. Uh-oh. What the hell? Oh crap, I'm dead. Your ability apply on head. Mark enemy champions. Big brain. I think I'll just go big brain. Big brain. Sounds good. I should just go back cap or something. I tried to. Fucking hell! I tried to. The Pokemon. Nice. Uh-oh. Stay away from the burn. Oh my god, the ability is just kind of insane. Shit. Guys, I need help. I'm gonna. I can't move! I just can't move! Oh my god. That was actually bad by me. That was really bad by me. Oh my god, insane amount of ability he's done. Yo, Chuggy. Well. What the hell is going on? Okay, he should live that. Why did he flash out? He literally had my ult on him. Not again. Too deep. Oh my god. I couldn't. I wanted to ult the Cho'Gath, but he went in way too deep. Couldn't reach him. Well. Well. Nice hit. Got a kill. I have no idea what's going on, but something's going on. Oh my, I thought he's gonna come and kill me, so I tried to ult him myself. Nice, I said. Well, bye-bye. Oh, he's just getting perma blasted, man. Oh crap. Oh crap. Bye-bye. I don't think it really killed me. Never mind. Oh, barely lived that. So not fun though. Got it on. Wait. Talia's dead? Nice. No, I hit the ult. I had 7k gold. Oh my god. kind of makes sense why I was feeling so useless there. $7K gold. That was like barely doing any damage, but it was being so annoying. Wait, Verstappen can officially use his exit clause. So basically, what Max Verstappen F1 did that his contract is a little weird because he can exit whenever he wants based on how the team performs. So within summer, if the team performs really bad, he can just choose to leave. And that's exactly what happened now. If he is not in the top 2 in any of the races until the summer, then he could just choose to leave. I don't think he's gonna leave though. Also, Ferrari has officially hit 250 wins. Oh my god. I think almost every Ferrari driver has won at least one Grand Prix, you know. Still pretty good. Still pretty decent. You got the Cartus. I don't know why I feel like playing Cartus. I was on the game with the Cartus. Okay. Tank engine, let's go. Let's go. Tank engine. Let's fucking go. Heavy. They're all ranged except Lucky. Do I see a Prattman here? Nice. Back. I dare you to come at me. I don't really find a way to engage there. Oh, got a kill. Let's go. Left. Nice. Nice, nice, nice. 245 health gained. I can actually dive in. 1, 2. Oh, big. 2 birds in 1 stone. Let's go. Be careful, I'm less lucky. Oh no, bye bye. Oh no! It wasn't meant to be. What the hell? What just happened? Wait, why did Aatrox learn while I was just chilling back getting the potions? Okay, Aatrox is back. It could ult someone. Of course. He's just dead. Nice, I got the kill as well. Like, we're 3k gold up. I get the assist for that. Tank engine going really good so far. What the hell? Never mind, I think I should just run. But why is Karthus playing so far? What the hell? Holy, wait, nice. Instantly killed him. I kind of greeted for that health, what the fuck. Oh, I got a kill as well, let's go. It's not like I'm not doing anything, I'm actually being quite useful to the team. Even being low on HP. Run! Run, Forest, run! And that's what you get for trying to poke me. That's what you get for trying to poke me. Shit. I shouldn't have done that, I think. Yeah, I'm dead. Yeah, I finally get to cash in. Oh my god. Juliet. I finally get to cash in. I should go for something really disgustingly offensive. And that's the first thing I can think of. Yeah, I'm just gonna run at them. They have to flash away. Somehow. What the hell? Guys, why am I being free hit like that? Where is my team? How long do they expect me to hold that? Okay, I'll just go quickly grab every potion that exists. I still have my ult, but I'll use it for it. I can guarantee a kill or something. Oh, fuck, it went wide. I'm dead. Impassable sounds tempting. Let's see. No questions asked. Yo, let's go. Money! I'm here. They're so fast. Ow. I should have gone warm walks. I have no idea what's going on here. Arctis died again, apparently. Nice. How did I die? What the fuck? I was actually that low. Or Vex just does too much damage. Yeah, Vex just does too much damage. Okay, now we go Warmlocks. Oh, I tried to snipe it. But casually walk away. Nope, no one saw me there. Lol. Yeah, I definitely need Warmlocks for this game. Ow. Wait, hold up. Crap. How are they winning though? I mean, Kartus keeps dying for no reason somehow. I don't know how. He just goes in and dies. Just like that. Just like that. I was just talking about it. Oh my god. Fucking Kartus. Average Kartus gameplay. Oh, according to Keikaku, I threw that ult like that on purpose. I was just dead. No! The heal had to come out right then. Aww. Yeah, he still dies. But all according to Keikaku, that was the plan. A minor mishap, but it's okay. The weather's kind of making my throat a little fuzzy. Okay. Nice. Okay. Alright. What did I ever do to you? Come here. Ah. So low! So low! What the fuck? Throat spray? What should I go in now? Do I go on my defense then, or? Do I go Shaksha or something? I think I should just go Shaksha. Okay. No way he escaped that. Yeah, I think I should go something AP-ish. I mean, not AP-ish, MR-ish. Let's see. Gale has pork, which is scary. Still here? Okay, thank you for the lyric. Wait, he's dead. Surely he's dead. I'm just slow. I can't really catch them. You still playing League? Nice. Dead. Dead. Let's go. I'm too big. Nope, don't think today is a good day for League. I don't think every day is not a good day for League. You know, yesterday you said that. Yeah, I sold my boots. I sold my boots. I'm a big wall. I'm literally a big wall that can one-shot people. Oh shit, I don't have... Oh no, growth spot in 2 seconds. Oh, I'm dead. It's too late. Too late. Oh, my mental is mad again. Just take a small break. Be like me, play ARAM. And chill. And then you just get back to it later, I guess. I don't know what to go here. Maybe I should just go Force of Nature. Just feel like that's the way to go. Karthus is, look at this Karthus spam things, oh my god. He's the only one even using things at this point. Oh. Nice. What? Are you gonna die? Wait, I thought the Lucian was AFK. I haven't seen him at all. He just disappears. I think he just dies immediately and no one notices him. Okay, 800 is still not bad. Nice. Build the Vex. Okay, they get just getting brutally murdered. Lol. They just got brutally murdered. Imagine if I had drop kick. Imagine if I had drop kick. It would be the end of their team. No. I'm just going in. Fuck this. I don't take damage. What the fuck? Never mind. I'm dying. That killed him. To kill them. Lot of, you're not good in general, right? A lot of stress. Yeah, you should take a break from League because League just adds on to stress. I'm telling you. I was feeling a little down today before stream, and I thought, okay, I still have an hour left to stream, so I'll play a little bit of ARAM, and yeah, my mental took a toll there. After 2 matches, I had to lie down for 10 minutes, and that was like 10 minutes before the stream, to calm myself down. Wait, did I get someone? No. Uh-oh. I should just stay back for a minute and get back my health. Yeah, back to full HP. Whoa! Chill. What is that damage? Okay. Can I do something here? Oh, almost killed the KO. I'm trying to get around it and still play good, even though my mental is bad, you know, but it's really hard. Well, I mean, and then you lose, and then it takes even more of a bigger toll on your mental, and then it just starts accumulating. So I don't think it's really worth it. It's rather do something calm and peaceful than do something that's gonna end up making you have even more stress. Because trust me, all my bad stuff that happened did happen when I was playing League. Or around the same time as playing League. Yeah, a break does. A break does help. Plus it resets your MMR a bit, so it's still good for you. Shit, I'm dead. What is the damage? What is that bullet time damage? Oh god. Just blasts this ult on my face and does so much damage. What the hell? I should have gone something like Frozen Heart, honestly. Kind of regret not going Frozen Heart. It would at least slowed them down even though I don't have boots. So I can still catch up to them. Now they just keep running away from me while I'm trying to pop them. They're so desperate to end. They were just so desperate to end. It just started once I started feeling better and starting to climb shit happening. Yeah, it's just better to relax. Or you can just go play normals and not flip out at all. Just reset. Just completely reset. And actually, you know, it actually works. Not playing League for a long time. Like, not playing League at all, not even ARAM or normals, kind of resets your win rate, because it happened to be a lot of times during exams, especially like I don't play League for a month or two or even more, and then when I come back to it, I automatically start winning games all of a sudden. That's literally what happened from my iron to plat grind, because I did not play at all before I started my grind, and I was like literally grinding TFT. I was literally grinding TFT last season before I started my rank grind. I want to call it a day. I think let's end for today. I'll be back on Tuesday, guys. Today was kind of fun. I hope you guys learned something from it, aka not to trust WebMD with diagnosing your conditions. Anyways, the VOD will be uploaded on YouTube and Twitch, and the clips will slowly be uploaded on YouTube and Instagram. Thank you so much for following. Thank you so much for watching, guys, and thank you so much for following all my social media accounts, and also thank you so much for supporting me through this. I did not expect you guys to show me so much support through my YouTube and Twitch, YouTube and Instagram especially. Twitch is sort of a slow thing. I'm slowly going to it. I'm so happy that my Instagram and YouTube sparkles are showing up on Twitch these days, so I think it's kind of helping us. Hope you have a nice rest of the day. Yeah, I'm gonna sleep. It's midnight. It's 1 a.m. Thank you though. Thank you, Zaki. I hope you rest too. See you on Tuesday again. Bye-bye. Wait, let's rate someone. Let's fucking rate someone. By the way, who is on? Let's rate someone. Caitlin. Let's rate Caitlin. Caitlin showed up on stream, right? A few minutes ago, an hour or two ago. Sending the raid to Caitlin. Guys, join. Caitlin is my evil half. I'm joking. She's Caitlin. I can't say it. She's a personality. She's a personality. Caitlin is a personality. It's a vibe. Okay, I hope you guys join her and support her as well. Thank you so much for watching my stream. Bye bye.